Dr. Kristin Mattocks, the Associate Chief of Staff of Research and Education at the Veterans Administration's Central Western Massachusetts healthcare system in Leeds, recently received a $1.1 million grant. It's aimed at improving the relationship between the VA and outside providers, and it's one of 3 VA grants looking at ways to better serve veterans' healthcare needs across the country. Carolee McGrath sat down with Dr. Mattocks in the studio to find out more.
We've been doing some research in this area for the past 3 years, ever since the Veterans Choice Program was initiated in 2014. And the goal of this work is really to kind of better understand how the VA can create partnerships with community providers and have those be sort of high quality relationships with community providers. When the Veterans Choice Act came about in late 2014, it really happened because there was a feeling that veterans were having to wait too long in the VA to get their care, and there were some questions about how far veterans were having to travel to get VA care. And so the Choice Act really was one of the first major pieces of VA legislation that really aimed at letting veterans get care in a community that is closer to them and maybe not having to travel so far or wait so long. So when the Choice Act was first passed, there were pretty strict standards about if veterans were waiting longer than 30 days in the VA for care, or if they had to travel further than 40 miles, they would be eligible for what we call, used to be called the Veterans Choice Program, and now we just say community care. So in those 3 years, or basically 4 years now since the legislation was passed, we've learned a lot about how the care has gone in the community. And when it was first passed, there were really a lot of problems with veterans being able to find community providers who would provide the care. And there were lengthy wait times in the community. There were still lengthy wait times in the VA. So the goal of this particular grant is to try to understand how the VA can really work better with those community providers to make sure veterans are getting the care that they need.
Now, there was a new report that was just released by the GAO, or the Government Accountability Office, that said that some vets were still waiting as long as 70 days, even with, the Choice Act. So, where do you go from here with this?
The VA is an enormous healthcare system. I mean, we care for 9 million veterans at over 160 sites of care across the United States. I think VA facilities have done a good job decreasing their wait times, but I think that there are still problems that exist. One of our challenges is just like the private sector, there are places that it's just hard to recruit providers to come and provide that care in the VA due to various physician shortages and things like that. So there are certainly still waiting times, that exist. Much of what I've seen in the VA, though, in terms of trying to promote this community care is really recruiting providers across communities to really, encourage them to be part of the network that provides care for veterans. So that is, I think, one way that the VA is really trying to, make sure that veterans get the care, if not in the VA, in the community.
And explain a little bit about the Veterans Mission Act as well. I know that this was passed in June, so this replaces the Choice Act?
Yes.
And are you hopeful with the provisions in this legislation?
Yeah, the legislation is actually very interesting. The specifics of it are still being worked out, and it probably won't actually go into effect for another year. But what it does allow, it could potentially allow veterans even more choice in terms of getting care in the community. And what's interesting about the Mission Act is it really brings, I think, providers much more into the fold in terms of working with veterans to figure out what's best for them in terms of where they should be getting their care, and whether that care is in the VA or whether that care is in the community. So it kind of takes, these hard and fast VA rules that have been in place for years and years, and it relaxes them a little bit to say what's best for the veteran. The VA is really into this program right now called Whole Health, which really is about, kind of meeting the veteran where they are and making sure that, what are your goals for your health? Okay, let us help you achieve those goals. And is that progress going to be made within the VA, or is it best to send you to the community? So there's a lot of really interesting changes that are going to be happening in the next year when that legislation is implemented.
So certainly when the Choice Act was passed and there was a lot of criticism, lodged at the VA for the wait times and everything, I think the sentiment was, and maybe still is, look, these are men and women who serve our country. If
Right.
anybody should be first in line for
Right.
health care, it should be them.
Right.
Let's get this right and let's fix this. How do you address the frustration that might come from people, about the VA?
Yeah, I've been in the VA for probably 12 or 13 years now, and what I see in the VA is just people who are really, really committed to caring for veterans. There is hardly a person I know, either at our facility or across the country, who's not really completely committed. I think, like many other large bureaucracies, we have some problems. It's hard to get people hired. Sometimes our, information technology, in terms of some of the things we're trying to do, is a little bit slow. But I do really believe across the board that the people that I see working with veterans every day are the most committed healthcare professionals I think I've ever seen.
And last year we had the chance to do a story on Ward 8, which I know is offered up in Leeds. It was an amazing program, some great people, and obviously that works with veterans who have PTSD.
Right.
How do you encourage veterans who need help today, to reach out to the VA? Because I know there's so many services up there and there's so many good-hearted people, as you had mentioned, who want to help. How do you encourage them to do that?
One of the things that we know about veterans is there are many veterans who could potentially be enrolled in the VA that aren't enrolled. And so one of the things that we're always saying, you see our staff out doing outreach at the Big E and places like that. First step is come to the VA and to see if you're eligible for the care. And I think that is so important for a lot of veterans who just aren't enrolled. I think that once you are in the VA, I think there's a lot of incredible programs to take advantage of. Some of the other work I've been doing lately is about pain and just the enormous numbers of pain treatment options that most VA facilities have these days. So, you could do cognitive behavioral therapy, you can do acupuncture, you can do massage, you can do, Pilates in some facilities. I think that the VA has really tried to think broadly about medical plus non-medical ways to treat veterans. And so I would say to veterans, coming in, just know that in almost every case there's just such a broad array of treatment options at almost any VA facility you go to.
So as a researcher, and you've been at the VA, what do you think are ways that could improve communication or those relationships with the outside providers?
Well, I think there's a number of things that we can do to improve those relationships. From the time that I've been in the VA and have been working with community providers on one thing or the other, the thing that we hear the most often is the VA is a big black box. We don't know who to talk to. We don't know who to reach out to. So if we have a question about a veteran that we're treating in the community, we don't even know who to contact. And so I think part of our goal is to really figure out ways to enhance those relationships between VAs and community providers, such that community providers know who to call and who to reach out to when they are seeing a veteran. The other big problem that the VA absolutely needs to address is paying its bills on time. I can't tell you how many veterans I have spoken with over the course of the years who have gone into collections because their bills haven't been paid on time. They visited a community provider under the Veterans Choice Program, and for various reasons the bills haven't been paid, and the veterans have those bills that they're responsible for that they shouldn't be responsible for. So I think another part of it is kind of figuring out, and I know at VA Central Office they really are doing a lot of things to improve that process, but I think that there are relationships that probably need to be mended across the community. A piece of the research I do is working with women veterans in pregnancy. And one of the things that we have found with that research is that, women have a baby, they want to go back to the same obstetrical provider with their second pregnancy, but they have found that that provider is no longer willing to provide care for the VA because their bills weren't paid. And so, from the perspective of a woman veteran who has a beloved obstetrical provider, she should absolutely be able to go back to that person and receive care. So part of what I want to do in this grant is to figure out the source of some of these tensions between VA community providers and figure out ways to, address those and hopefully improve those relationships.